Good afternoon, Elliott.
And Elliott, yes, I've received a letter from yourself,
Yes.
Mr. Glasgow, Martin Glasgow.
Oh, right, yes.
Yes.
How can I help?
Can I place an order with you
For?
for my medical records going back to 1997?
They're not there. We haven't got them.
Going back to 1997?
All that exist are the actual notes that are in your file at the moment.
The notes that are in my file at the moment?
Yeah, are the ones that we've got.
How many are there?
I don't know, to be honest. I've not got your file at hand, and if you require them, you have to go through Access to Health to get them. We can't provide them for you.
Access to Health to get them?
Yeah. They're upstairs.
So they don't go back to 1997 then?
Pardon?
They don't go back to 1997?
No, that's what I said to you, that we don't hold any old notes at all.
You don't hold any old notes at all?
No, if you've not attended the hospital for 8 years continuously, your case notes are destroyed.
Your case notes are destroyed? That's a bit strange, all that is, isn't it?
That is national guidelines, and we're allowed to destroy them after 8 years of you not visiting the hospital.
I would have thought under the Data Protection Act that you would have to have my permission to destroy any information.
No,
according to the Data Protection Act, nothing can be destroyed until 7 years after death.
No.
That's what the Data Protection Act stipulates.
That's not correct.
Pardon?
That's not correct. No. It's not 8 years after death. No.
No, I said 7.
No, it's still not. It's 8 years anyway.
It's strange my record's going missing, isn't
8
it?
years. It's not gone missing at all.
They've not gone missing at all?
No. What I said is, if you have not attended the hospital for 8 years, your notes would be destroyed.
How would you know, if I were rushed into hospital,
and then when you
how would you know what allergies I've got, or what what my blood group is, or anything like that?
This is policy, so I've got no physical hard copy records of only what are in your file at the moment, which I don't know what they are because I've not had access to them.
So they go back to 1997?
I don't know what's in your file. That's what I've just said. I don't know what's in your file.
So how can you...
I've only written you this letter because your consultant asked me to write. He wrote to me and asked for if you've got any previous records. We said no, and then he asked for me to write to you.
So, this means, just one second, this means that a patient does not attend the hospital for appointment in 8 year period, hospital records are destroyed. You last attended in 1997.
Yeah.
So obviously, you should be able to tell me what that was about.
No, I'm sorry, I can't.
You can't tell me nothing.
No, because we've just had a brand new computer system, and the only information we've got is back to 2009. It's all stored on an old system, and we haven't got access to it.
Back to 2009?
Yes. You've got your notes that exist at the moment with everything in it.
Yes.
So on the system, the only appointments and things that we can see are back to 2009.
It says 1997
that's
here.
different. We talk about two completely different things. You're talking about your hard copy records.
Yeah.
Right, and I'm saying that you're wanting them back to 1997, and that was the last time you came to the hospital,
yes,
up to whenever you've just started coming again. So those records don't exist because it's more than an 8 year period. So national guidelines say that after 8 years of you not attending the hospital, your records can be destroyed.
Who do I write to?
For
a copy of my medical records.
Your medical records don't exist anymore, apart from the ones that are current.
Yeah, that's what I'm after.
The current ones?
8 years, you said?
No, whatever's in your file at the moment, that when have you been coming to the hospital recently?
What recently do you mean?
I don't know, because I've not got access to the system at the moment to look at I've not got your records in front of me. So you've been coming to see a consultant because that consultant's obviously sent me a letter and asked me to write to you explaining why that your old records don't exist.
What about, obviously, such as accidents?
Accident and emergency is a different story. A&E keep their own records.
So all the records are not put together?
No. No, only A&E records that go in your general notes are if you are admitted from that incident. But A&E keep all A&E records.
So it's all connived together to basically deceive people.
No.
It sounds like that to me.
Why is it connived?
I wasn't told that anything about 8 years national guideline on destruction policy.
Well, that's...
Just one second, please. I was told that my medical records have gone missing.
I have no idea about that.
I was told by my own doctor that my medical records have gone missing.
No idea.
And the only person I can recollect having anything to do with my medical records is a PC McGrogan stopped me in the street in 2007 asking me for permission to access my medical records. I was told they've gone missing.
Right, I have no idea about that. That was not what I was asked to write to you about. I was asked to write to you and explain why your records from 1997 weren't available, and that's all I've written to you and explained. I don't know, I've not looked at your records or anything, I have no idea.
So I need to go to the... You can't keep them separate. It's a continuation. Why would the accident emergency keep separate records?
Because it's not part of your... Unless you're admitted from that, accident emergency is different.
It's the same... Everybody's got an individual NHS number, haven't they?
Correct, yes.
Yes.
They have.
So, as soon as anything goes on the system, it's got to be associated with your NHS number, because that's the... Just one second. Because that's the primary key to a relational database.
Right. It is indeed.
Pardon?
It is, yes.
That's correct.
Yes.
I'm well conversant with relational databases.
But the hospital...
Because just one second, any information you put down on a system, on a branch system, say your department, has got to be associated with my NHS number. Not anybody else's, it's got to be associated with my NHS number.
I'm not saying just attached to anybody else's NHS number. Your NHS number is unique to you.
That's correct. That's why it's used as a primary key.
But that doesn't mean that we don't destroy things and work to national guidelines. The only true continual record that you will ever find is your GP record.
Sorry, I just didn't hear that because I sat back in a creaky chair.
So the only true records that you will find that are continuous for the whole of your life are your GP records.
GP records?
Yes.
Because I find this very strange, because like I was assaulted in Chesterfield Royal Hospital in 2006.
Right.
By someone who's claiming to be someone he isn't.
Well,
everybody's been telling me that this person is somebody other than he really is.
Well, that should probably still exist. But if it was an A&E incident, then A&E have that record.
Yeah, but I presumed it was in the A&E department.
Right.
But because...
So were you admitted to hospital for that?
No, I wasn't admitted to the hospital, but the strangest thing is that it wasn't the accident and emergency department.
Right.
It was some other department that looked like the accident and emergency department.
Right.
Now I've tried to source CCTV footage from this incident, not the incident itself. The people involved that ran away from the hospital and was allowed to go home by the security.
Right.
Now this Jed Holland,
Right.
he helped set me up in the hospital, otherwise he would have released the CCTV footage.
Right. I'd say that's nothing to do with me at all. I don't know about that. I've no idea whatsoever.
Unless of course someone else at the hospital was involved.
I have absolutely no idea.
Like a doctor.
No, I've no idea.
Seems a bit strange, this, doesn't it? Well, this CCTV footage, what I'm after.
Well, that's nothing to do with the hospital records anyway. That
I know it isn't.
Surety, I mean, I don't know anything about that.
Now, he tried to deceive me.
Right.
Now, being a Microsoft professional and a network engineer as well, I know all about the importance of disaster recovery,
Right.
backups, and off-site backups where every time you press that key, it doesn't just log onto your system there, put the information in. There's an off-site system which everything that's done at the hospital is replicated for disaster recovery.
Right.
Now, this situation with this Jed Holland, it's on the internet now, and the hospital, where I was assaulted,
Right.
in the coronary care unit.
Right.
I'm planning to put even more. In fact, I'm thinking about putting this letter on from you, because I think this is just a put-off letter.
Right. Well, I'm sure it isn't. I was asked by the consultant to explain to you why your notes didn't exist, and all I've done is explain to you why your notes don't exist.
Because they've been stolen.
No, they haven't been stolen at all.
So why don't they exist then? Because it doesn't matter about being...
White on the letter. They're
Pardon?
being destroyed.
It shouldn't be... They don't get destroyed. How do you know what blood type I am? Or if I've got any allergies or anything like that, if I have an emergency?
They do get destroyed.
Well,
I assure you.
yeah. So who do I write to for my medical records?
You need to speak to, you need to write to patient safety.
Yeah.
Access to records is access to records you need to write to at the Chesterfield Royal Hospital, asking for a copy of your personal records.
Okay, Anne. Thank you very much for your time and
All right.
advice. Thank you
Okay,
very
thanks.
much.
Bye.
Bye-bye.